Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hi, I'm the weight loss champion, Chuck Carroll. Thank you so very much for watching and downloading in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And today, our focus is on the gut. And we welcome back to the show my good friend, all the way from the UK, the Devon Gut Clinic guy. He is our dear, dear friend, Dr. Alan Desmond. Welcome back to the show.
How are you, Chuck? You good?
I'm great, man, and I'm even better because you are here.
Oh, thank you so much. It's so good to be back with you and back with the exam roomies. Yes, let's talk about gut health. Let's put a spotlight on gut health today.
Absolutely. First things first, got to make sure you're doing okay. I know you came all the way over, saw you last night, a little bit jet lagged.
Yeah, I was a bit jet lagged, but I had good sleep last night. This isn't cola, this is coffee.
Okay.
So I'm responsibly caffeinating because I want to be on my A game for you and your audience.
Outstanding. And let's start with this. I know that we have a lot of things that we want to bounce into, but let's start with the coffee. That is highly debated in the nutrition community.
Sure.
Coffee, yay or nay in terms of gut health?
Okay, so that's a great question. Now, we need to declare a intellectual bias here.
All right.
Okay.
Let's do it.
Because I enjoy coffee. I need a vice. I need a vice. I don't drink alcohol anymore. I go to the gym. I eat healthy food. I'm vegan. I have a whole food plant-based diet. I want to build a better life for me and my family by making these healthy habits.
Right on.
Automatic.
Qualifier out of the way.
Yep. But I need a vice.
All right.
My vice is coffee and caffeine. But it turns out, Chuck, that my vice is good for me.
Good, man.
Because not only do we know that coffee helps to protect our neurological health, we've seen some really interesting presentations on Alzheimer's disease at this conference, but also coffee is a plant-derived brew. It's rich in polyphenols and antioxidants and a whole bunch of other plant-derived substances that we don't even have names for yet. It's not just about the caffeine, and decaf is also good for you. Big review published in the British Medical Journal a few years back, an umbrella review of all of the data on coffee and health. I remember that day dearly because on the front cover of the British Medical Journal, they had a mug of black coffee, and the headline on the front of the British Medical Journal was "Coffee Gets a Clean Bill of Health."
Oh.
So coffee consumption seems to substantially reduce our risk of bowel cancer and liver cancer. Now, that being said, if you do not enjoy caffeinated beverages, if they reduce your well-being, if the cognitive effects make you feel anxious or jumpy, or if it's interfering with your quality sleep, then that's a net negative for you.
Right.
So if you don't drink coffee today, you don't need to start tomorrow.
Right.
Okay? But if you do enjoy coffee, then that is a net positive for your health.
I would imagine, though, there's a big difference between that black cup of coffee that you're enjoying or was on the cover of the BMJ and, one of the big macchiatos, lattes,
Oh, yeah.
all of that.
Yeah, you don't want an Oreo macchiato or something, you want, we're talking about the black stuff, okay?
Yeah.
So that's where we get all of these benefits. And if you don't enjoy coffee, if you don't enjoy caffeine, then a good decaf is great. If you don't enjoy coffee at all, then a good tea also has its own unique health benefits, bringing those plant-derived polyphenols and antioxidants to your day. So a nice little add-on to your healthy plant-based diet.
All right, let's dive into gut health here. And coffee drinker or not, you see a lot of people who come through your clinic. And they always say to you, and probably outside of the clinic, whether you're at a wedding, a social event, they're probably hitting you up on DMs on social media, my gut's just not right. Something is wrong. What is the first thing you tell them?
Well, the first thing I would say is go and talk to your doctor. Okay, so we know that a healthy plant-based diet offers substantial protection from numerous GI problems that fill our GI clinics and our wards. Got some of the statistics right here in front of me.
Yeah.
So diverticular disease affects 1 in 3 adults in the UK, 1 in 8 vegans. Bowel cancer affects 1 in 23 men, 1 in 25 women in their lifetime in the US. A healthy plant-based diet may reduce that risk by up to 80%. Gastroesophageal reflux disease affects about 1 in 3 adults, substantially implicated the standard Western diet, the high-fat diet. Gallstones affect about 15% of the US population. We know that people who don't eat animal products may be up to 50% less likely to get gallstones. And when we look at inflammatory bowel diseases like Crohn's disease and ulcerative colitis, which affect perhaps 1 to 2% of the US population right now, 2.3 million Americans, we know that a healthy diet and lifestyle may reduce the risk of those conditions by 40 to 60%. But, Chuck, low risk is not low risk. This is really important. And if you're eating a healthy diet and leading a healthy lifestyle, that is marvelous. The benefits just stack up. It's compound interest every single day.
Right.
Okay? But low risk is not no risk. So if you have worrying symptoms, if your GI health is not good, do not be embarrassed. It's really common. Go talk to your doctor.
Yeah.
Get it checked out. Look, everybody, I assume, who is listening or watching right now, everybody eats, chews, burps, farts, and poops. It's a universal truth among humans.
What we do, man.
That's what we do. So do not be embarrassed to go and talk to your doctor, even if they don't know anything about the benefits of a healthy diet. Our family physicians, and of course, healthy diet is becoming more and more relevant, right? But even if your doctor isn't aware of all this research, they will be able to help you to decide whether you need some important tests to make sure that you don't have a serious GI condition.
Right.
Now, some of the tests that your doctor may talk to you about, or you may wish to talk to your doctor about, would include things that you'll need to come and see someone like me for, maybe, a gastroenterologist. We would usually start with basic blood work to make sure there's no evidence of anemia or abnormal liver function tests that might point towards a gallbladder problem. You might end up coming into me for the day to have a gastroscopy, a camera where I can look down into your GI tract or up into your large bowel. Is one of the privileges of being a gastroenterologist. We get to look at the living organ that we are treating every single day at work. How cool is that? That's one of the things that attracts me into gastroenterology.
Yeah.
You may need a camera test. We might find some precancerous bowel polyps and remove them to reduce your risk of developing bowel cancer. We may find hemorrhoids or diverticular disease. We may find Crohn's disease or ulcerative colitis. You may need an ultrasound scan of your tummy to make sure you don't have gallstones, which, as I said, affect about 15% of the US population, much less likely in people who eat a plant-based diet, but not impossible.
Right.
You may need an MRI scan of your bowel to look for any evidence of Crohn's disease. We won't find that unless we get these scans done. Or you may need some of the fancier tests, like something like a small bowel capsule endoscopy or a pill test. So please, if you're worried about your digestive health, go and talk to your doctor. Get those important tests done.
Yeah.
And that's got to be the start of the journey. But of course, what happens next is really important, okay?
What would be next?
So what happens next, and what I see all the time, for a lot of people, getting those normal tests, excellent. They realize they don't have a problem. And often that reassurance can help, okay?
Yeah, yeah.
But for many people, they are still left living with very substantial GI symptoms, indigestion, constipation, bloating, diarrhea, or whole body symptoms related to food. And what they are told is, all of your tests are normal, it's just IBS. It's just irritable bowel syndrome. Now, if all of your tests are normal, that is fantastic. That is excellent news. But
is it? I would imagine that'd be like really frustrating because you want an answer.
Well, no, it's good. We haven't found any of those disease processes.
Okay.
So that's good news. But really, that needs to be the start of the conversation. This concept of irritable bowel syndrome, IBS, unexplained GI symptoms, vastly underestimated the impact that this has on individuals. So I see patients at my clinic all the time who've been told they just have IBS, and they are housebound, they've lost their jobs, they're not able to go into a public place without knowing where all the bathrooms are.
Right.
It has a substantial negative impact on one's quality of life. It's true, all health does begin in the gut, and if you don't have gut health, your quality of life goes down very quickly. In fact, research tells us that individuals with significant symptoms, unexplained GI symptoms, would give up 15 years of their life expectancy for a treatment that would restore their gut health. That they would be willing to risk a 10% chance of dying to go on a medication that would restore their digestive health. This is important. And like I said, this needs to be the start of the conversation. All your tests are normal. Let's figure out what's going on. We need to talk to and listen to our patients. And very often that conversation begins with
the diet.
What do you eat?
Yeah.
We need to talk about it. And I see many patients coming to my clinic who've had all the tests done, fantastic, good on them, and going and talking to their doctor, and good on their doctor for organizing these important investigations. But nobody has spoken to them about the food that they eat. And as we've talked about previously on this awesome podcast, the standard Western diet, the high meat, high dairy, fiber deficient, fruit and vegetable deficient, legume deficient, leafy green deficient, high processed food, high junk food diet that we know as we used to call it the standard American diet, the SAD, then became the standard global diet. Okay, so we know that that diet is a recipe for terrible digestive health. And that's not laying the blame on individuals. It's the food culture that we come up with.
100%.
Okay, this is the food that is presented to us as convenient and desirable.
Yeah.
It's what we are sold.
Yeah.
Okay, and we need to push back against that. And at clinic, I will start with like 4 basic questions. Okay, often, I'm lucky, certainly in my private clinic, I spend 45 minutes on that first consultation and subsequent consultations, but often we are pressed for time in clinic.
Of course.
Okay, so we can do a lot of fact finding when it comes to food in very little time.
Yeah.
Okay, so when I see patients at clinic and I want to start a conversation about food, how many pieces of fruit do you eat every day? How many servings of vegetables do you eat every day? How many servings of whole grains do you eat every day? And due to our highly industrialized food system right now, often the answer that patient will give me is, I love fruit. I have an apple every day. Right. That's one.
Yep.
I love vegetables. I have them every weekend with my Sunday dinner.
Once a week, okay.
Once a week. And you just asked about whole grains, doctor. I'm not quite sure what those are, actually. Are you talking about the bread with the seeds on top? And it would be funny if it wasn't so tragic,
right?
Because that's where our education around food is. So people recognize that fruits and vegetables are healthy, but they don't eat them every day.
Yeah.
And people often don't really know what a whole grain is. They may think about a whole grain breakfast cereal or something. That would be their first go-to.
Yeah.
Okay.
Yeah.
But if I can get to the point where my patient answers 3 servings of fruit, and that could be real simple: an apple, a banana, and an orange. Okay. So 3 servings of fruit, 3 servings of vegetables, and 3 servings of whole grains every day, then at that point, they are consuming about ballpark 30 grams of fiber per day.
Would you still count that if it were 3 apples as opposed to the apple, the banana, the
Yeah,
orange?
well, that's the diversity piece.
Yeah,
okay, so we can talk about that later. That's now we're getting to honors level. Now,
okay.
But for many people, we've got to meet them where they are.
Right.
And if we can get them to those 3 servings of fruits, 3 servings of vegetables, 3 servings of whole grains every day, and we will often at that point get rid of the dairy milk as well.
Sure.
That's a big question that we need to talk to our patients about. Then we have got them to the point where they are ready for a healthy dietary intervention. So we got to put that groundwork in first. And look, that's a very old concept. I mean, that dates right back to 50 years ago. Dr. Dennis Burkitt, one of my professional heroes, who introduced this new concept into nutrition. Fiber.
Oh.
Okay, fiber. Prior to Dr. Burkitt's work in the 70s, we thought fiber was just a scrubbing brush, right, to keep everything moving along.
Yeah.
And we know that that's really important now, but we also now know that our dietary fiber and the diversity of plants in our diet are the key to achieving good gut health. So that's just how we start the conversation about food.
All right, so let's say that then you get them to that 3 plus 3 plus 3. The 3 fruits a day, the 3 vegetables, 3 servings of whole grains. Still symptomatic. I imagine at some point, and we've seen these talked about a lot online as well, what is the next line of testing? A lot of people will say, well, what about a poo test?
Yeah,
Am
sure.
I ready for a poo test at that point? That conversation comes up where you think that that's the next step. What exactly would you be looking for?
Oh, sure. So yes, we are able to get poo tests done. And at my clinic, on my desk, I have this little bucket, and it's filled with tiny little small plastic containers, which have little brown lids on them.
Yep.
And
how appropriate.
And at clinic, I will hand my patient a little tray, some gloves, a little brown tube, and an instruction leaflet, because yes, we need some poo in the lab.
Yeah.
Okay. And there are evidence-based, reliable tests that gastroenterologists will order on your poo. So a list of those, and again, I have it right here in front of me, so I don't want to miss anything. We will test for abnormal blood loss. So that might be a FIT test or a colofit test. So if you've got abnormal blood loss in your stool, then there's something up. We want to have a look and check for inflammation, check for cancer, check for adenomas that could become a cancer in the future. We will check for abnormal levels of gut inflammation. That's a fecal calprotectin, elevated in infections, but also elevated in conditions like Crohn's disease, ulcerative colitis, sometimes diverticulitis. So that'll be a reason we want to get you in for that colonoscopy. We will check your digestive enzyme production. Fecal elastase, another poop test. So there's a condition called pancreatic exocrine insufficiency, where you're not making enough digestive enzymes. So we will test that on a poop test. And if patients are having like diarrhea and fevers, we will check for common bugs that we often get from contaminated animal products or fruits and vegetables that have been contaminated with water that was contaminated by the animal industry or the animal agriculture. And we'll be looking for things like salmonella and E. coli and other infections, or giardiasis, which you can pick up from fouled water and can become a long-term issue. So yes, there are a lot of poop tests that gastroenterologists will order, but one that people are really interested in right now is comprehensive microbiome analyses. Okay.
Microbiome, my ears just perked up.
Microbiome analyses. So we have learned so much about the gut microbiome in the last 20 years, and there are plenty of private companies that will count the different bacteria that are in your gut microbiome. They will tell you what those bacteria are. They will measure some bacteria that we really don't even know what they do in terms of human health. They will measure some stool assays that are not validated, and they will try to give you advice on that. But I got to say, Chuck, the science isn't there yet.
Gotcha.
Okay, so comprehensive microbiome analysis right now remains a research tool. And although it can give you some pointers towards what you may like to do with your dietary change, it's not something that I yet order regularly within my GI practice. So yeah, comprehensive microbiome analysis, interesting. If a patient comes to my clinic and I've had that done, I will go through with them. But the results aren't reliable enough, to my mind, to use this as a really useful diagnostic or clinical tool.
Doesn't sound like that's the kind of test that would be able to tell you one way or another whether you may have like a food allergy or a sensitivity to a particular food, right?
Yeah, that's important.
So that's a whole other set of tests.
That's a whole other thing. So people will often ask about food sensitivity testing. So let's just talk for a minute the difference between food allergy and food sensitivity.
Okay.
Okay. So a food allergy, we are talking, peanut allergy or cow's milk allergy. So this is serious, life-threatening stuff. These are individuals who will be exposed to that food and then will develop a rash, difficulty breathing, tongue swelling, anaphylaxis, immediately life-threatening. If those are the symptoms you're experiencing, of course, you don't need a gastroenterologist. You need a clinical immunologist, because you're developing anaphylaxis-type symptoms and you are looking at the advice of an immunologist and maybe carrying an EpiPen and absolutely avoiding the trigger. So that's a different sort of condition. What a lot of people are concerned about in terms of their digestive health is, do I have a food intolerance? So this is distressing symptoms like bloating, heartburn, indigestion, constipation, or diarrhea, or sometimes symptoms beyond the gut, such as brain fog, sleepiness, itchiness, etc., that are developing when they consume certain foods or food groups. And in fact, about 20 to 65% of patients with functional GI symptoms, unexplained GI symptoms, will identify that they suspect that they have a food intolerance. Now, unfortunately, we don't have any good tests for food intolerances, but that doesn't stop a lot of companies marketing tests for food intolerances and charging people money to do their food IgG tests in their blood, to do this thing called Vega testing, which measures changes in your electromagnetic field when you consume certain foods.
Vega, I believe. Vagus nerve, kind of? Is that
Vega, like Dr. Spock or something. I'm not sure. Vega, like vegan. I don't know. I don't know. But kinesiology testing, hair analysis, leukocytotoxic tests, all of this stuff. There's no evidence to support them. I have patients who come to my clinic all the time. They've been given this huge list of foods they need to avoid based on some unproven food intolerance testing. I got to tell you, sometimes they'll have been told to avoid so many foods that they hit gold, okay?
Yeah.
Like typically, I did the Vega testing, it cost me this much. They told me to avoid 19 foods, including dairy milk.
Right.
I feel a lot better.
Yeah.
Therefore, the Vega testing worked. It doesn't work. I wish these tests did work, because then we would use them all the time at clinic.
Sure.
So really what it goes down to is a food and symptom diary. And that's something that a good gastroenterologist or a good gastroenterology dietitian, and I'm very lucky to work with some awesome dietitians. Shout out to Sarah Jones and Deborah Howland. I would get no work done without these amazing people who I have as colleagues, as dietetic colleagues, going through that food diary for a 5 to 7 day period. What are the foods you're eating? And what are your symptoms like can be really, really informative. And of course, we can sometimes open that discussion with our patients simply by asking, okay, you've had these symptoms for a long time. Have you discovered any foods that you really have to avoid? And that starts to give us clues towards dietary intolerances, which in most cases are amenable to or reversible by healthy dietary change with temporary exclusion of the trigger and then gradual reintroduction of the trigger.
That sounds like that could be a painstakingly slow process.
It can be, but it can also be extremely rewarding.
Absolutely. I would imagine so. There's a lot of great apps that you could use to log, and Food Journal make it really easy for you.
Of course, yeah.
Chronometer, free shout out to those guys for that. What if we jump ahead to another type of intolerance, and that's histamine intolerance? This seems to be kind of the new kid on the block in terms of GI health and overall health. First of all, when we're talking about histamine intolerance, as a refresher, I think we talked about this maybe once on the show before with our friend Will Bolsowitz. But for those who aren't familiar, what is histamine intolerance?
Okay, that's a great question. So, I mean, the common dietary intolerances that we will discover at clinic will be lactose intolerance, dairy intolerance. We've talked about that before.
Yeah.
Sometimes it will be gluten intolerance, which might be celiac disease, or non-celiac gluten sensitivity. We've talked about that before. Sometimes it will be the highly fermentable foods, the FODMAP foods, the beans, the legumes, and those sorts of foods, which are an intolerance. And all of those, like I said, are usually amenable to healthy dietary change. Okay. Right. But the new kid on the block that we are hearing so much about, both in the public discourse and at medical conferences, is histamine intolerance. So histamine intolerance in the general population is quite rare. We think it occurs in about 1% of people. So, however, at the GI clinic, among patients with unexplained GI symptoms or functional GI disorder, about half of those individuals will describe symptoms that are triggered by foods that are high in histamine or foods that trigger the release of histamine in your GI tract. Now, just to be clear, histamine is normal. Your gut is supposed to produce histamine. Histamine has some important functions in terms of GI motility, making sure that your stomach produces acid to help to digest your food, and other roles within your gut. So histamine is normal.
Right.
The problem, and it's supposed to be produced when you consume food, normal digestion.
Right.
Okay. The problem arises when the histamine that's been produced when you eat your food is not broken down. So it's usually broken down by an enzyme called DAO, diamine oxidase. And if it's not doing its job and breaking down the histamine, then you get increased histamine in your gut and in your bloodstream. And this is where we get those first clues from the patient food and symptom diary. Because the symptoms they're describing will often include full body symptoms and GI symptoms. So we're not just talking about diarrhea, although we are. We're not just talking about bloating, although we are. We're also talking about nausea, vomiting, headache, runny nose, these kind of rhinitis symptoms, these allergy type symptoms, itching, rash, fast heart rate,
right,
provoked by food.
Right.
So very often these patients will come to us with a very long food diary and a long list of symptoms. And if they've been seeing someone who's not aware of histamine intolerance, very often it can, because the doctor may not be aware of this condition, and because it seems to be affecting every organ in their body, the doctor may think, oh, no, there's nothing going on here. This person is making this up.
Right.
You know, well, of course they're not. Now, there's many reasons why you might develop histamine intolerance, but primarily it comes down to that enzyme, that DAO, not doing its job.
Right.
Okay, so in patients who we suspect have are having histamine-related symptoms as I described, we need to have a think about, is there something driving this? Now, there are underlying conditions like inflammatory bowel disease, chronic kidney disease, liver problems, and even just simply growing older can reduce the DAO activity.
Not much we can do about that one.
There's not much we can do about that last one, okay? So there's multiple reasons why someone might develop issues with excess histamine. The other big one is medications, actually. So there's about 1 in 5 adults are in medications that can potentially inhibit DAO activity. And the big one for me would be the non-steroidal anti-inflammatory drugs, the ibuprofen.
Right.
And high-dose aspirin, which people use as temporary painkillers. But if you use those long-term, they've got a whole host of negative GI effects, including inhibition of DAO. So what happens if you develop histamine intolerance? Well, you're getting all of those symptoms. You may be on some medication that's been driving it, so we need to have a talk about that. But the foods that typically really provoke histamine release or contain histamine would include alcohol, wine, beer, whiskey, champagne, alcohol, processed meats, cheeses, fermented foods, fermented vegetables like sauerkraut, certain vegetables like tomatoes, eggplant, spinach, certain tropical fruits, pineapples, bananas, papaya, citrus fruits, fish like mackerel, tuna, sardines, herring, and shellfish. It's a wide variety of foods, but often we'll identify that these are triggers for the patient that are developing body-wide symptoms. So we need to talk about histamine intolerance. So we've done all the other tests, we've ruled everything else out. So how do we treat that?
Right.
Well, this needs to be something that's done with a dietitian who knows about histamine intolerance.
Right.
Because we're going to put you for maybe 6 to 8 weeks on a strict low histamine diet. We're going to take out all of those foods that I just mentioned and more, and we're going to have you on a low histamine diet. We're going to give you medications to reduce histamine production, antihistamines. We're going to suggest that you supplement with DAO enzymes, 0.3 milligrams 3 times a day, for the duration of this very strict intervention. And at the end of maybe 4 to 8 weeks, if you have substantially improved and you've been doing the diet, then great. And I've had patients who struggle with symptoms for years, and we've gone through this difficult process.
Yeah.
And their life, their quality of life is absolutely transformed. We restore their gut health. We restore their overall health. We restore their well-being and their ability to eat food, which is fantastic. But just like any restrictive diet, at that point, we want to try to reintroduce these foods and find levels of tolerability. And again, that needs to be done with a dietitian. So you need to seek out that registered dietitian. You mentioned Will's book, the Fiber Fueled Cookbook.
Yes, sir.
Has some awesome low histamine recipes in it, and also talks in detail about this condition. But you know, we will phase 1. We'll let people have mushrooms and legumes again, and we will try and get them back to a point. And very often we'll end up with patients who are on fewer medications than we did during that initial 8-week period, and they're able to eat more broadly than they ever were before, and it's a real win. So histamine intolerance, okay, it's not super common in the general population, but if anything that I've said in the last 10 minutes resonates with you, whole body symptoms, then go and have a talk to your GI.
What about gluten intolerance, as long as we're talking about different intolerances? I know that's something that you also covered here.
So is bread the enemy?
Is it? You tell me, sir.
Is bread the enemy? Bread is generally not the enemy.
That is good to know.
So bread is generally not the enemy. But if the patient is coming to clinic and we ask them, are there any foods you need to avoid? And if they mention breads or gluten-containing foods as a trigger for their symptoms, for their unexplained GI symptoms, then first of all, we need to find out, well, what is that gluten-containing food? Are you talking about the cheese-stuffed crust with the pepperoni and, you know, the kilo of cheese on top? Because that might not be the gluten.
Right.
Okay. Are you talking about the croissants that you like to have for breakfast every morning? Because that might be the butter and the oil and the sugar. But if it's genuinely gluten-containing foods, including healthy whole grains, etc., then maybe it is the gluten. Yeah. Maybe this person has celiac disease. Yeah. So that's very easy to check for. We'll run a blood test called a TTG. And if that's positive, we generally do endoscopy, get a little sample from your bowel and confirm you have celiac disease. The good news is that you have celiac disease. We can treat that completely with a healthy gluten-free diet.
Outstanding.
Okay, and when we are getting people on a gluten-free diet, then we need to make that a healthy gluten-free diet.
Of course.
Because very often when people exclude gluten-containing foods from their diet, they're also having to exclude by necessity healthy whole grains.
Sure.
So gluten-containing whole grains, and some people are sensitive to oats as well. There's a cross-reactivity there. So at clinic, you need to be educating that person, sharing powerful information with them. Okay, you have celiac disease. We are highly recommending a gluten-free diet, but let's make this as healthy as possible. Let's use naturally gluten-free foods. Okay, fruits and vegetables and sweet potatoes and brown rice. You know, these are healthy foods. Let's use naturally gluten-free grains and pseudograins in your diet, like buckwheat and teff and rice and quinoa and abra and sorghum and millet. So these are completely friendly foods for your gut and your gut microbiome, for your overall health, also completely edible on gluten-free diet. And we need to help people to avoid becoming overly dependent or dependent on the highly processed gluten-free foods that are on the supermarket shelf. So we've got gluten-free everything, right? We've got gluten-free everything. So we often these gluten-free breads and cakes and cookies and biscuits have even more artificial food additives and even more sugar and even more salt than the regular cookies and cakes and highly processed foods. And there's a good literature out there showing that individuals who need to or choose to embark on a gluten-free diet, statistically, their dietary quality is going to be reduced. We know that their gut microbiome may suffer negative consequences because they've cut out the whole grains and they're eating more processed gluten-free foods.
All right, let's end with this question. Let's say that somebody's just like really frustrated. They've been eating a really bad diet for a really long time, Dr. Desmond, and they want to feel better as quickly as possible. And they've heard of something called the fecal transplant.
Okay, sure.
And so if you take somebody like you who's been eating a really healthy, whole food, plant-based, well-rounded diet,
Yep.
and you take some of your poo and you generously give that to the other person and you transplant it up there, would that help their GI symptoms?
What an interesting question.
Thank you.
So fecal microbial transplant, poop transplant.
Yeah.
It's a thing. So in the gastroenterology world, there's one condition that we know responds really well to FMT. And that is a condition called C. diff infection. So C. diff is a bug that lives in about 1 in 20 people's GI tract. It can be there in a healthy gut microbiome. But if you're exposed to antibiotics, if you're immune suppressed or you have another GI illness, then that C. diff can grow and start producing toxins and become a real issue for people. It produces recurrent diarrhea, a form of colitis, can be very debilitating. Treatment usually involves a lot of antibiotics, which can come with their own side effects. And it can be a very devastating illness, actually. So we know that if we take a person with recurrent C. diff infection, we give them some antibiotics, and then we put healthy, non-C. diff affected stool into their large bowel, the fecal microbial transplant, we can cure that condition in 90% of cases. So many hospitals now offer fecal microbial transplant for that exact reason. We do it at my hospital. So we give fecal microbial transplant for that reason. And how do we give you the fecal microbial transplant? Well, we got options.
Do we?
We've got options. So we get that healthy poop. It needs a little bit of processing.
All right.
Okay. And we can give it through an NG feeding tube. Or NJ feeding tubes. We put it real deep down into your small bowel.
Yeah.
We can freeze dry it and put it into capsules or crapsules. Or we can do a camera test and we can put it into your large bowel directly where it needs to be.
Up the other side,
Up
right?
the other side with a colonoscope.
I mean, now, look, if we're just talking about me, I got to say, like, none of those sound particularly appealing. However, of the three options, I would much rather it go directly to where it needs to be than have to swallow it.
I agree. And the fact that we've got so many different methods of administrating this thing, so many different protocols, is one of the reasons why the FMT research is a little bit difficult to interpret, okay? Because a lot of centers are doing it differently. But the question you might ask, well, look, okay, if vegans have such a healthy gut microbiome, which is widely recognized in the medical literature, then can we make people generally healthier by giving them a poop transplant from healthy vegans?
Yeah.
And researchers have looked at this. There's been studies looking at fatty liver disease and metabolic syndrome, where volunteers with these conditions have had microbiome transplants, FMTs, from specifically healthy vegan donors. Okay, so those papers are very interesting. And what you see is you see moves within the gut microbiome towards a vegan-like microbiome with reduced production of inflammatory mediators, reduced production of TMAO, etc., slightly better glucose tolerance, that kind of thing. But the effects are generally short-lived. It doesn't work, Chuck. As far as we can tell right now, it doesn't work. The results are disappointing. So you look at those studies and you read those studies and you think, okay, so they're going to all this trouble of giving these people who need a healthy change a poop transplant from a healthy vegan. Maybe you could just buy them a cookbook or enroll them in a cooking class and get them to eat more fruits and vegetables, whole grains, legumes, nuts and seeds, and they wouldn't need the FMT. So it's got to be food first. And in fact, there have been studies looking at when you do both. So you give the FMT and a healthy diet. Okay, so you might assume that that would be the, that would be the holy grail of gut microbial rehabilitation. But actually it may not be, because we've seen a study published 2 years ago, the CRAFT UC trial, looking at patients with ulcerative colitis, a form of inflammatory bowel disease. So the researchers gave volunteers with ulcerative colitis either a poop transplant or a poop transplant and a healthy plant-forward, unprocessed, high-fiber diet, or just the healthy diet. Okay? They hadn't even finished the study when they realized that the people who were getting the healthy dietary change alone were doing far better than the other groups in the research study. And that research study was shut down and they stopped because the ethics board said, look, you're trying the FMT, you're trying the FMT and healthy diet, and you're trying healthy diet. The people just doing the healthy diet are doing so well, it's not ethical. You got to stop this study. So FMT is often produced or often spoken about as a shortcut to a healthier gut microbiome. We are not there yet with the science, and in fact, having an FMT comes with its own risks.
I would imagine. Flavor being about the top of the list there for me. You're swallowing it like the little brown pill, It's like, but yeah, that's very interesting, and I think that common sense here. Again, I'm not a doctor, but I think common sense would tell you if you give them a recipe so they could make their own healthy poo, I think that that's probably the best step, and a lifelong recipe.
Absolutely. Yeah. And I just love the fact that we're here on the mics very comfortably talking about bowel movements today, because like I may have said at the top of this conversation, everybody uses the toilet, Chuck. And I think if we got more comfortable talking about this, it would be so awesome for people's digestive health, because often people are experiencing problems in the bathroom and they are so embarrassed to talk about it. We love food. Every weekend you pick up a newspaper, there's like 8 new recipes to try.
Yep.
You turn on the TV, we're looking at cookery shows. Like number one, people just love food. They love to look at it. They love to talk about it. But after we've eaten that food, we get like acutely embarrassed about what happens next. So please don't be embarrassed. My job would be so much easier if people were willing to mention the fact that they were having digestive health problems.
Right. Be an adult. Talk about
Be a grown-up.
Yeah. Yeah, let's end the stigma when it comes to you know what. All right. You're a good man. I wish we had more time.
Oh,
Dr.
me too,
Desmond.
Chuck.
This has been
Next
great.
time.
Appreciate you, my friend.
Thank you so much.